Have you ever experienced chest pain that feels like angina, but your coronary arteries appear normal on an angiogram? You might be experiencing microvascular angina, also known as cardiac syndrome X. In this video, we'll explore this often misunderstood heart condition, covering its causes, symptoms, diagnosis, and management. Join us as we delve into the world of microvascular angina and shed light on how to live well with it. The exact cause of microvascular angina remains a bit of a mystery, but researchers believe it involves a complex interplay of several factors. One key element is dysfunction of the small blood vessels, the microvasculature, within the heart. These vessels may not dilate properly when the heart needs more blood, such as during exercise or stress. Hormonal imbalances, particularly estrogen levels in women, can play a role. Other contributing factors might include inflammation, insulin resistance, and an increased sensitivity to pain. It's likely a combination of these elements, rather than a single cause, that leads to microvascular angina. The pathophysiology of microvascular angina centers around the impaired function of the heart's tiny blood vessels. Normally, these vessels should widen to allow increased blood flow when the heart needs more oxygen. However, in microvascular angina, these vessels fail to dilate sufficiently, leading to reduced blood flow to the heart muscle. This mismatch between oxygen supply and demand causes ischemia, a temporary shortage of oxygen, which manifests as chest pain. Furthermore, the abnormal function of these vessels may trigger inflammation and endothelial dysfunction, further exacerbating the problem. Nerve endings in the heart may also become more sensitive, amplifying the sensation of pain. Microvascular angina is more common than previously thought, especially among women, with a higher prevalence around the time of menopause and beyond. It's estimated that a significant percentage of patients undergoing coronary angiography for chest pain are found to have normal coronary arteries, and a portion of these individuals likely have microvascular angina. While accurate prevalence data is still being gathered, it's clear that this condition represents a significant portion of undiagnosed and undertreated cardiac pain. The primary symptom of microvascular angina is chest pain, often described as aching, squeezing, or burning. This pain can be similar to typical angina, but may be more prolonged and less predictable. Unlike typical angina, it's less likely to be triggered solely by physical exertion and can occur at rest or during times of emotional stress. Other common symptoms include shortness of breath, fatigue, and palpitations. Some individuals may also experience pain in the jaw, arm, or back. These symptoms can significantly impact quality of life, leading to anxiety and limitations in daily activities. Diagnosing microvascular angina can be challenging because standard tests, like coronary angiography, often show normal results. The diagnosis typically involves a combination of clinical evaluation, symptom assessment, and specialized testing. Doctors may use stress tests, such as exercise stress tests or pharmacological stress tests with imaging, to assess heart function under stress. However, these tests may not always reveal abnormalities. More advanced tests like coronary microvascular function testing, which measures blood flow in the small vessels of the heart, can be used to confirm the diagnosis, but they are not widely available. Ruling out other potential causes of chest pain, such as esophageal spasms or musculoskeletal problems, is also crucial. Microvascular angina isn't typically classified into distinct types, but rather considered as a spectrum of severity. The focus is more on understanding the underlying mechanisms and tailoring treatment to the individual patient's symptoms and contributing factors. The treatment and management of microvascular angina aim to relieve symptoms, improve quality of life, and reduce the risk of cardiovascular events. Lifestyle modifications play a crucial role, including regular exercise, a heart-healthy diet low in saturated and trans fats, and smoking cessation. Medications often used include beta blockers to slow heart rate and reduce blood pressure, calcium channel blockers to relax blood vessels, and nitrates to improve blood flow. Aspirin may be recommended to reduce the risk of blood clots. In some cases, other medications such as ACE inhibitors, statins, and ranolazine may be considered. Addressing contributing factors like hormonal imbalances or insulin resistance is also important. Cardiac rehabilitation programs can also provide supervised exercise and education. While completely preventing microvascular angina may not be possible, adopting a healthy lifestyle can significantly reduce the risk. This includes maintaining a healthy weight, eating a balanced diet, engaging in regular physical activity, managing stress effectively, and avoiding smoking. Controlling other risk factors such as high blood pressure, high cholesterol, and diabetes is also crucial. Regular check-ups with your doctor can help identify and manage potential risk factors early on. The prognosis for individuals with microvascular angina is generally good in terms of overall survival. However, The condition can significantly impact quality of life due to persistent chest pain and other symptoms. Recent research is focusing on developing more accurate diagnostic tests and targeted therapies to improve symptom management. Studies are exploring the role of inflammation, endothelial dysfunction, and genetic factors in the development of microvascular angina. Novel treatments, such as enhanced external counterpulsation (ECP) and therapies targeting specific inflammatory pathways, are being investigated. These advances hold promise for improving the lives of those living with this challenging condition.